what is otalgia അല്ലെങ്കിൽ earache? So that is means here there is pain in the ear. Okay, it may be due to causes occurring locally in the ear or may be referred to it from some remote areas. Okay, so that is otalgia or the earache, and the local causes may be in the external ear or in the middle ear. Okay, in the external ear maybe the causes were furuncle, then impacted bags, otitis externa or otomycosis, laryngitis bullosa, herpes zoster or malignant neoplasms. Okay, so what are the local causes in external ear? Mainly impacted bags, then furuncle, okay, then otitis externa, then what you can remember, okay, herpes zoster and malignant neoplasms. Okay, malignant neoplasms, herpes zoster, impacted bags, oxidase, okay, the ഇത്രയും ഓർക്കുക. Okay, and otomycosis also. And what are the local causes in the middle ear? Okay, middle ear നമുക്കറിയാം acute otitis media, eustachian tube obstruction വരുന്നത്, then mastoiditis, extradural abscess, okay, then carcinoma middle ear. So these are the middle ear causes. Okay, so first we discussed about the local causes which leads to pain in the ear. Next we are discussing about the referred causes which leads to pain in the ear. So referred causes mainly our ear receives nerve supply from the 5th cranial nerve, 9th cranial nerve, and also from the 10th cranial nerve, and also from the C2 and the C3 cervical spine also. Okay, so we are the 5th cranial nerve, that is auriculotemporal branch is supplying, and we are the 9th cranial nerve, that is the tympanic branch, and 10th is the auricular branch is supplying. Okay, so these are the nerve supply to the ears. So if any conditions that is like leading to problems that is supplied by these nerves, this will also cause pain in the ear also, and we call this pain as referred pain. Okay, so we are studying about the pain, that is we are the cranial nerve, 5th cranial nerve. Okay, so the pain near the 5th cranial nerve, maybe if there is problems in the dental like caries tooth, apical abscess or impacted tooth, malocclusion or constant syndrome. Okay, so these will lead to pain in the ear also. Okay, so that are the dental reasons. Then through oral cavity, okay, if there is any benign or malignant lesions, ulcerative lesions of oral cavity or the tongue, because the anterior 2/3 of the tongue is separated by the 5th cranial nerve, like the tooth is also separated by the 5th cranial nerve. So if there is any benign or malignant ulcerative lesions in the oral cavity or tongue, this leads to pain in the ear. And also temporomandibular joint is separated by the 5th cranial nerve. So if there is any temporomandibular joint disorders like bruxism or osteoarthritis or recurrent arthro dislocations and ill-fitting denture, okay, and also the sphenopalatine neuralgia. Okay, sphenopalatine neuralgia. Okay, next is we are the 9th cranial nerve. So the 9th cranial nerve, that is the glossopharyngeal nerve, that is mainly supplying the base of the tongue, styloid process, and also the oropharynx. Okay, so if there is any tuberculosis or malignancy in the base of the tongue, okay, tuberculosis or malignancy in the base of the tongue, that leads to pain in the ear, and elongated styloid process, and also in oropharynx if there is any acute tonsillitis, okay, acute articular tonsillitis, and peritonsillar abscess, tonsillectomy ചെയ്യുമ്പോൾ, okay, or other benign or malignant ulcers of soft palate, tonsil and its pillars. Okay, so these all will leads to pain in the ear. Okay, so what are acute tonsillitis, tonsillectomy, peritonsillar abscess, and if there is any benign or malignant ulcers of the soft palate, tonsil and also its pillars. Okay, then base of the tongue the tuberculosis or malignancy. These are also leading. We are the 9th cranial nerve. Okay, and the next is the 10th nerve. But 10th nerve mainly supplying the vallecula, epiglottis and larynx. Okay, so if there is any malignancy or ulcerative lesions of the vallecula, epiglottis and or larynx or the laryngopharynx and esophagus, okay, this will leads to pain in the ear. Okay, നോക്കണം അപ്പോൾ vallecula, epiglottis പോകുന്നുണ്ട്, അത് കഴിഞ്ഞിട്ട് larynx, laryngopharynx, esophagus വരെ ആ ഒരു ഇത് വരുന്നുണ്ട്. So next is we are the C2 and the C3 spinal nerves. Okay, C2 and C3 spinal nerves are. So if there is any cervical spondylosis or injuries of the cervical spine or caries spine, okay, so in these conditions also there will be ear in the pain, that is earache. So otalgia means it is a symptom. Okay, so you should find the cause first for treating that, for its treatment. Okay, first you should find its cause, then only specific treatment can be instituted in case of otalgia. Okay, so these are the causes for referred causes for what? Otalgia.